Assalamu alaikum guys. So today the journal session is back again with another video, and today we will discuss about the how to take history from a patient who came with the abdominal swelling, that is hernia, basically incisional hernia. So so this is the topic, and today is 18th of January 2024. So starts with the initials. First of all, starts with the introduction, and take consent from a patient that you want to take the history. If he or she is comfortable with you, so proceed further and ask about the biodata of the patient, and then comes to the presenting complaint. Usually patient comes with the complaint of soiling in the abdomen or lump in the abdomen, or the associated symptoms of hernia like pain, and these are the symptoms. So it starts with the history of presenting complaint. Okay, so when did the patient notice the hernia? Did the patient operated before? Previous operative history? If yes, then when it was happened, what was the reason? It was an elective operation or was the emergency procedure. Did the patient have notes or discharge card of that operation? What patient know about his operation, his or her operation? Okay, these are the questions. Then ask about, did the patient, did the surgeons made stoma previously, and drain were placed at that time. So if the drain were placed, then how long the surgeon kept the drain inside, and was there any history of the wound adhesions, and intestinal prolapse outside? Was there any wound infection or discharge from wound? Thus, the DTS were placed after the wound adhesions. Okay, so these are the questions regarding the previous operation, and there are some other risk factors too, which will be discussed later on. So, after asking the previous operative history, then ask about the when the patient noticed this lump, and after how many time of the previous operation the patient noticed the lump. So this is very important. Okay, is the lump reducible or irreducible? Okay. Does any posture like lying, sitting, and standing affects the lump? Like if the patient is standing very prolonged, does the lump become reducible, and then the patient lie down, the lump will become reduced on its own. Okay. Ask about the does the patient lift weight at home or do weightlifting at the gym? So it's very important. Ask about the cough, chronic cough, and repeated chest infections or repeated respiratory infections. Okay. And does the patient have constipation problem? Ask about the micturition. Is there any problem with the micturition like increased frequency, biliary dribbling? Okay. And ask about the pregnancy. Like after the previous operation, the patient had became pregnant or not, and the lump size has been increased or decreased during that time. And ask about the thing that some at, at some time the lump became irreducible and stuck, and you became constipated and then went to the hospital with vomiting and nausea. So ask about the subacute intestinal obstruction or acute.